Good day, I'm Michael Woodworth with Makari Wellness, and I just want to take a moment to introduce some of the ideas behind our orthopedic and pain treatments. When people come in, it's a daily occurrence. They come in and they say, oh, I've tried chiropractic, I've tried physical therapy, I've tried dry needling, I've tried acupuncture. And that's great. What they're doing is they're trying to fix a problem with one tool at a time. And the metaphor I give patients is that when you take your car to the garage, they don't just fix your car with a screwdriver. And so to think that one provider with one skill set is going to be able to correct a problem that's of any significance or any complication, it's not realistic. So over the last 15 years of my private practice, I've been flying around the country and training nonstop, and to this day I do. Seek out the best professionals, the people with the most effective treatments, and I integrate that. And so I've created what I like to refer to as the Makari method, which is nothing more than really bringing to our patients the best stuff I can find. And so we do have a logical order of thinking, and we do have an operating procedure that we follow. So the first part is that we diagnose and identify the problem. So it's not that your pain, where your pain is the problem. There's a whole slew of possibilities that could be contributing to pain in a distal area. So the first part is we identify what's going on. So we look at the body and we use a bunch of diagnostic systems from traditional Chinese medicine, but namely in physical problems, we're going to approach it from physical medicine or manual therapy. So we look for inhibited range of motion. We do a scan over the body. Then we look for mobility. We look for function or inhibited muscles. And then we look at your overall stability, or how those structures are or are not working together and working properly. Because once you do have an injury and you've undergone some trophic changes or physical adaptations, you've created habits and started rewriting your nervous system or movement software under compensation, and those become new movements. And this is how people who undergo surgery or therapy then have a recurring problem, because no one has actually corrected that particular individual's way of movement. So we start with mobility, function, and then stability. And this it also includes a nervous assessment, vascular assessment, and muscle, tendon, ligament assessment. So then we look at your, once we finish that, we look at your static posture. Okay? With that, we filter that through our combined understanding of traditional chiropractic, more complicated posture corrective stuff like Pedibond posture, rehab chiropractic systems, specific movement assessments like SFMA, FMS, dynamic neuromuscular stuff, and then in the background of that, we're always looking through the lens of Chinese medicine, meridian diagnosis, and more of an osteopathic understanding of the physical body. So kinetic chains, fascial planes, and then only when that's corrected are we thinking about strength. Because you can't strengthen one part of a dysfunctional chain without causing harm to the preceding or following parts of that chain. Okay, so strength is the last thing we're worried about, and you can do that on your own. So once diagnosed, we have a large toolbox on how to treat whatever it is we find. So most often what we're doing is we're combining our deep orthopedic acupuncture, or what's commonly become phrased as dry needling. But more deeply than that, we also are very adept at using acupuncture to neuromodulate. So this might be treating particular tissues, needling into them to break them up, changing kind of beef jerky to filet mignon, if you will, so that that tissue can expand, so that you can perfuse blood through that tissue, so that you can make get rid of noxious materials and things that are inhibiting movement, restore proper function to that tissue. A lot of the neuromodulation is treating brachial plexus, cervical plexus, lumbar plexus, stimulating even points on the scalp to really reintegrate. That's a very common thing that we use in our stroke treatments, but to reintegrate the nervous system and neuroplasticity with the physical body, so that connection, if you will. It has to be restored. A lot of people don't realize they're missing a lot of those connections. And once we do that, our needling work, which is a very big part of our treatments, then we go into the manual therapy. So for tissues that we can touch, right, because that's the big difference, the needle can go where the hand can't go, into different depths and layers of tissue between bones, especially in treating spine and nerve impingements. Then we use manual therapy, so that's where things similar to massage therapy, but we subscribe to active release techniques. We feel that that's the absolute gold standard of soft tissue management. It's very precise, it's very detailed, so our sense of anatomy is well studied and, once again, never ending. Then we might use cupping, that's more circulatory. More often than not, we're using gua sha. Now you'll see people touting it as Graston or instrument-assisted soft tissue release. It's where we use a tool to basically help change trophic changes in the tissue so that we can break up scar tissue, elongate those fibers, break up cross collagen fibers that have laid down to kind of, as your body tries to quickly repair itself, it often does so, but not in the correct manner. You may have some fibers laying across other fibers. So this is how we break up scar tissue and adhesions. A lot of people aren't aware that their body, just like a Band-Aid will stick to a scab, inside of us we have all these different layers of tissues above, below, and beside one another that should move freely in different movement planes and tensions. A lot of times they actually scab together because we've spent many days sitting in a certain position, or we do repetitive movements that create micro traumas. So we could go into all of these things in detail, but it's that approach where we identify, we treat, but then we educate. So we're going to educate in terms of nutritional supplementation, if there's internal dysfunctions in terms of chemistry and vascularization and metabolisms of things. We might get into Chinese medicine, but more often than not, people are okay. They really just need education in terms of correctively training the body to perform movements. Every movement we do, no matter how complex, is really made up of basic or primal movements. And we're gonna, once the tissue can perform its function, and there's no pain, and you can move through the motion without pain, then what we're going to do is we're going to correct that movement. We're going to show you how to do that. We're going to provide you videos so you can do that at home, because we do realize that coming to any provider is really, especially us, it's an allocation of resources, and the two biggies being money and time. So we want you here as little as possible. It is definitely our approach that and we are really successful. And getting people better fast and getting them back to their life out of our office, and with very little follow-up. Some people have gone for a long time, so they'll need an occasional a monthly follow-up or 2 months, but like I tell all my patients, we're successful when we don't see you, and the best thing that we can do is provide service in a way that it's prefaced by integrity, and we earn your referral, so that we're in business because you felt that we served you well, and you want to tell your friends and neighbors about us. And that's how we've been practicing for a long time. So we help a lot of people. You can read our reviews that are out there. There's a lot of things that people don't review. There's a lot of people who don't review. But there's stuff out there where you'll see that we've helped post-surgically. We can really help a lot with acute trauma, accidents, etc. And if you haven't, if you've given up on acupuncture or chiropractic or PT, you really do owe it to yourself to come see us. Like I tell everyone, I have people that force their friends to come in, and they come in very hesitant, very doubtful and skeptical, and within reason. I get to see people after they've spent lots of time, money, and years in pain and nothing's worked, and then they're coming again to another person. So as my teachers would say, that I get to see people when they're at their worst, but the payoff is when you help them, you get the best response. So we give you the corrections, you rewrite that software over and over, you do it at home. It's not that complicated, it's not that encumbersome. We boiled it down to very core accomplishable tasks. And then, like most of our patients, we don't see you for a year, 2 years. Namely, you know, there's a couple things to consider if you're an athlete or one of our professionals. We have quite a few people who do performance for a job. If you're going to be a race car, you need a pit crew. So what you want is a pit crew that can help you not only perform better, but avoid injury. And we pride ourselves that we've accomplished that, and we're continually getting better. So thanks for listening to all that. Hopefully that helps people understand what we're doing here. We'll have some more in detail videos, but that's how we approach physical pain and a lot of the osteopathic, orthopedic conditions that come into our office at Makari Wellness. So let's make well, be well, and have a blessed day.